Hi, I'm Dr. Nichelle Haynes.
I'm Dr. Kristen Lassiter.
And we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Today is a really important video, and we have sort of struggled with how to give you this information and not make it really difficult. We're going to talk about risks of mental illness in pregnancy. So stay tuned. So when we thought about making this video, we both recognize just how important this information is, and also recognize that sometimes having this information can bring up a lot of feelings like what? Guilt, shame, disappointment, sadness,
Fear, worries.
And that's not our goal. Our goal is for you to have this information so that you can use the information to improve things for yourself and consider this information when you're moving forward and making treatment decisions.
I think a lot of times people are worried about what are the treatment options going to do to my baby or to the pregnancy. I don't want to expose my baby to something that will harm them, but I think we forget that mental illness itself is really a risky thing to expose baby to. So we wanted to put this video out there just to have information on what are the risks to a woman and her pregnancy and her developing baby when she has mental illness in pregnancy.
So important because, I have this conversation with my patients daily, right? And my spiel kind of thing is, we always worry, what does medicine do? Like, what's the risk of medication? And that's a really important question, but also having the information of what does mental illness in pregnancy do? What are the risks there? What does it increase the risk of?
And we'll go into details on what are all the risks of mental illness, but I think the big picture important thing to know is for the vast majority of medications that we have to treat mental illness, the risks of mental illness are actually worse or greater than the risks of the medication. So it's safer if you had to pick baby being exposed to mental illness or to medication, it's safer for the baby to be exposed to medication than to mental illness in general. Of course, always talk with your doctor about your individual medication.
And so let's talk about what those risks are. Maybe we can categorize it, right? We can say risks for mom/pregnancy health, and then we'll do baby afterwards. Okay.
Before we get into all the risks, though, I think it's important to define what is it that is mental illness when we're saying that. And basically, a lot of these studies were done looking at women who were experiencing a major depressive episode, also known as depression and pregnancy. And less studies have been done about women experiencing anxiety, but some of them kind of captured those symptoms as well. So that's what we mean when we're talking about mental illness and pregnancy. And then when we're talking about risk, it doesn't mean this is something that is absolutely going to happen. It means this is an increased risk or increased possibility of this thing happening due to the mental illness. And also we can't say necessarily like cause and effect with a lot of these research studies. It's just that people who experience untreated mental illness and pregnancy are at increased risk of these things.
Right. It's really nuanced. It's really nuanced. It's not like, this means that. It's like this increases your risk for that. And that thing has complications.
So you're going to talk about what the risks to mom are?
Sure. So one of the well-defined risks is an increased risk of preeclampsia. And preeclampsia is essentially high blood pressure in pregnancy that can lead to eclampsia, which is high blood pressure, protein wasting in the urine, increased risk of seizures during delivery. So that is a really high risk thing. So it's the precursor to a very high-risk thing that we would not obviously desire during delivery or during the end of pregnancy.
Yeah.
Right.
And then one of the other big things is risk of preterm labor and preterm delivery. And this is such a big deal because preterm birth, baby being born too early, is one of the leading causes of infant death and neonatal death. And so it's not a passive, oh, okay, the baby just comes early. It's something that really you want to protect against if possible.
Right. I mean, there's so much that happens in those like last few weeks. We have lung development, we have more brain development, lots of things that need to happen.
Yeah.
Ideally. Right. You also could potentially have an increased risk of miscarriage.
Yeah, we see that women who are actively experiencing depression have an increased risk of miscarriage. They also have an increased risk of hemorrhage during the pregnancy
And delivery.
and delivery,
Right.
and increased risk of having an emergency C-section.
You could have an increased risk of substance use, and kind of the assumption there is that you're feeling really bad, so you turn to something to help you feel better. And those substances, of course, carry lots of other risks depending on what you're using.
Yeah. You're less likely to eat healthy, exercise, go to your prenatal visits, and kind of stay on top of your health when you're feeling really depressed.
I think that's one of the really important things that we can use to point out that it's not this means that all the time, right? Like someone can be depressed and still go to their prenatal visits, but it increases the likelihood that you miss a few visits, or that someone's really depressed and they don't go to any visits, right? So this is one of those things that really highlights that point for they're not like 100% correlated.
Yeah. And then probably the most detrimental thing is that it increases the risk of suicide in mom, of course, which is something that we really want to avoid if possible. And I think a lot of times people are surprised when they notice that they start having suicidal thoughts when they're depressed, because it's not something that they've ever thought of before. But I think it's important to recognize that that symptom is part of the illness. And so it's not always something that people feel like they can control.
And then changes in ability to breastfeed, the decreased ability to breastfeed in the postpartum period.
Yeah. And then also having depression in the pregnancy is one of the highest risk factors for having postpartum depression.
All right, it's the biggest risk factor
Yeah.
for having postpartum depression. So those are the known ones for during pregnancy for mom.
Mhm.
What about for baby?
So for baby, this is really interesting, and I could get into all the science behind it, but it's just very interesting. If you ever want to go dig into the research, I highly recommend it.
It's fun for us.
It's fun for us. But essentially, they've done studies now with technology where we can see that baby's brain develops differently, structurally differently, in babies who were exposed to maternal depression in pregnancy versus babies who were not. I think it's really cool that we can have that information now.
Mm-hmm.
But I also think that that explains so much, because we know that babies who are exposed to depression, mental illness, and pregnancy are at increased risk of having developmental disorders, which we'll talk about, all these other things. And now we have evidence of it's actually doing things to their brain development during the pregnancy. Another kind of more substantial evidence to that is that we see fetal head circumference being different than babies who weren't exposed to mental illness in pregnancy.
Right, so it would be decreased.
Mm-hmm.
I think it's just maybe, possibly, some representation of the physiologic changes that you were talking about in brain development. And
Yeah.
we see that in head circumference.
Possibly, yeah.
Right. There could be increased adiposity for a child, which is basically fat on baby.
Or a
Or a
child
child.
obesity
Right.
later on in life.
Right.
There's also increased risk of neurodevelopmental disorders such as autism and possibly ADHD in children who are exposed to depression in pregnancy.
Mm-hmm. It's so complicated. I want to know more. Like, why? What is the thing? How does that happen? What can we do to improve that?
Yeah.
Yeah.
Babies who are like, when they've looked at babies in the first year, they see that they tend to have more developmental delays in that first year of life than babies who were not exposed to mental illness and pregnancy. And then we see, like, later on in their life as an adult or an older child, they have an increased risk of mental illness or behavioral disorders and things like that.
And I think hearing this information is one of the things that makes making this video so difficult for us, because we don't want you to think, oh, I was depressed during pregnancy. Now, oh my gosh, I ruined my kid, or, all of these things that I've heard from some of my patients, that this increases the risk. And there are definitely things that you can do if you know this happened, or you were depressed during pregnancy and maybe you didn't realize it, or maybe you didn't have the opportunity to get the help that you needed, that there are things that you can do even in pregnancy, later on in pregnancy, or in the postpartum period that can help improve some of the things that may or may not have happened, right?
Yeah, there's things you can do that then can help reduce the risk of these things happening. So definitely one of the videos you should check out of ours is how to bond with your baby postpartum, because really that bond and that maternal infant and parent infant relationship in that first year postpartum is so important for a baby's development. And we'll talk more about that in our other video about postpartum mental illness.
So lots of information for you to consider there. And really what this means for the way that we approach treatment is that we recognize how important treatment is during pregnancy, and not just saying, oh, I'll wait it out, I'll endure it, I don't want to take medication because that could be bad for my baby. There's lots of things that we sort of debunk on a daily basis with this information with our patients, and we hope that you having this information can help you make informed decisions about getting care for yourself.
Yeah, and I would add in there that some of these research studies have looked at the duration, how long somebody was depressed, and the impact that that has on these risk factors. And it is correlated. So the longer that people spend depressed in a pregnancy, the greater these risks are. And so I think that that's also
Something to consider
when you're thinking about starting treatment. It's not great to just kind of wait it out and wait till the baby's born.
So please like, comment, subscribe. Thank you so much for being here. We'll see you soon.
Bye.